Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau, International Honor Society of Nursing, is accredited as a provider for nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. The planning committee members and speaker have disclosed no relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we'll have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. We'd like to thank our speaker today for sharing their expertise with us. Our speaker today is Dr. Lisa Ruth Saad. Dr. Ruth Saad is a professor of nursing at York College of PA and an adjunct professor at Georgetown University in the MS and DNP program. Dr. Ruth Saad received her master's in nursing education from Villanova University and her doctorate in adult education from Pennsylvania State University. Dr. Ruth Saad has extensive experience as a critical care and emergency nurse and as a nurse educator. She is certified as a compassion fatigue specialist. She has been the recipient of the Nightingale Award for Nursing Education, and most recently, Dr. Ruth Saad has been accepted into the American Nurses Association Fellows for Nursing Education. Welcome, and we'll turn the presentation over to you.
Thank you so much, Megan and Linda. I just want to thank Sigma Theta Tau for having me speak today on the topic of externships. It's a topic that's very near and dear to my heart, and one of the factors that led me to present this program is that I have been a faculty extern coordinator for over 22 years, and I'll share some of those experiences with you as well. First, I'd like to say that this presentation will discuss what a nursing extern program is, so that hopefully by the end you'll be able to recognize some of the value in participating in a nursing externship. We'll look at some of the benefits, not only for the student, and those are the ones that are most highlighted in the literature, but also some benefits for the faculty who are involved in extern programs, as well as the institutions. When I say faculty, I am referring to academic faculty, so I'll highlight some of those key points and benefits. And then also I'll share with you some strategies to building collaborative partnerships which foster the success of extern programs. So let me first begin by discussing and kind of highlighting for you what is the definition of an externship. Sometimes there are lots of different titles, extern, intern, and it's a little confusing to the reader. So I'm defining, and the literature most commonly defines externs as student nurses who are close to graduating. So many externships are held for student nurses who are usually within 1 year of graduation, and I'll go into that in a little bit more depth. The word intern is usually saved for post-graduation positions and focuses on specialty units like the OR or the intensive care unit or cardiac step-down units. So that's kind of how we're going to define externship. So again, I thank Sigma Theta Tau for having me. I thank Linda and Megan. They both helped to put these slides together. And I'd also like to thank the many, many externs who I've worked with over the last 22 years. So let me ask a couple of polling questions. I think Linda or Megan are going to do those polling questions for us. just to kind of get a sense of the audience. So do you know a student nurse externship? Do you know what it is? Yes or no? Start off with an easy yes or no question. Okay, so that's good. 79% of you do know, so that's awesome. Okay, how about the next polling question? I wanted to kind of get a sense for the audience with this question. A student nurse or a novice nurse, a nurse with greater than 3 years of experience, and perhaps wondering how you could best help to facilitate an extern program, or are you an academic faculty member looking to create an extern program or work in some kind of a collaborative partnership? Or are you a hospital employee, perhaps an HR representative who might be interested in starting an extern program? Okay, so about 50% academic faculty. Okay, awesome. And that's what I am as well, so I'll be able to help you out with that. Okay. Were you a nurse extern at one time? Yes or no, you yourself? Okay, so no. So I will share with you that my whole development and interest in nursing extern programs really developed because I was an extern myself in 1982. So don't do the math. But that's where I really learned to get my appreciation for an externship. And again, I'll share why in a little bit. So thank you. One more polling question. So identify which of the following the nurse extern may not do. And we'll talk about this as well. What are some of the scope of practice that nurse externs are allowed versus what they are not allowed to do? So what do you think? Perform assessments, document, administer meds and blood products, and give report to the oncoming nursing team. Okay, so that's perfect. That is exactly right, what they are not allowed to do. Okay, so let's go back to the first slide then, Megan or Linda. And so as I said, we're going to recognize some of the value of nursing externships. And I defined extern as students, and that's what we'll talk about today. Some of the literature, as I mentioned, does refer to them as internships. But again, think of that as more of a graduate nurse. So the value of externships is that they are usually initiated by healthcare organizations through collaborative partnerships with local academic institutions. Externships are paid positions for student nurses who want to work roughly between 8 and 12 weeks over the summer. Externships take place when school is not in session as a way to kind of augment the students' clinical education in their pre-licensure program. Now, some institutions, and I know in this area, I'm in Pennsylvania, some institutions around here have different levels of extern programs, where a level 1 extern may be offered between the summer of the sophomore and junior year, and extern 1s have less clinical responsibilities than an extern 2. An extern 2 is offered the summer directly before the student graduates, and then an extern 2 may have increased clinical responsibilities. So that's one program that I'm familiar with in this area in South Central Pennsylvania that does it that way. They have like a two-tiered extern 1 and extern 2. So the number, excuse me, the number of externs accepted is usually based on the hospital institution or the healthcare agency, based on their financial interest and based on the number of positions that they have available for wanting to recruit nurses. So Linda shared with you earlier an article that was published in 2013 that looked about a cost savings technique to reduce the number of externs, and they decreased their extern pool from 100 down to 36 based on their financial needs. I can say that extern programs vary as far as how many externs they accept based on, as I said, finances and also the number of positions available. Most institutions also require an application process for the extern. And this process involves references. It involves sending a transcript so that the student can validate their progression, successful progression through nursing school. Oftentimes it requires a letter of intent for the student to state, what is their intent in participating in an extern program. It may also ask the students where they want to work upon graduation, because one of the values of a nursing externship is for that institution to then hire these nurses to work at their institution. So sometimes preference is based on students who say they want to work at that institution after externship is completed and after they graduate from their program. Other times, programs have a preference for BSN students, and that's to align their RN staff with baccalaureate prepared nurses to kind of align with the Institute of Medicine's need or recommendation to increase BSN nurses. Usually during the application process as well, the student nurse extern is asked to list 3 or 4 hospital units that they would like to participate in or observe in. And then during the application process, usually you try to match a student with one of their top 2 areas where they want to participate in their externship. So it involves references, a letter of intent, a transcript, units, BSN preference in some cases. And the other nice thing or value of nursing externships to the students is that they then can stay on during their senior year of nursing school as a nurse's aide. And they'll get paid to work that last year of their nursing school as a nurse's aide. And then the real benefit is they'll be allowed to apply to that institution as a graduate nurse, as an internal candidate, rather than as an external candidate. So they kind of have a foot in the door if a student does complete an externship at an institution in which they want to work. The other thing with externships are they do offer sign-on bonuses as well if externs do agree to take the position. So one of the things that I'd like to clarify in the beginning is that externs are not the same as student nurses. Not the same as nurse aides. They should not be treated as nurses' aides. So you don't want them sitting in patients' rooms for shift after shift doing patient sitting and that kind of thing. They should be aligned with a registered nurse preceptor and kind of following that preceptor, observing, helping, and doing RN tasks and assignments, not being equated to a nurse's aide. Externs also must recognize that they are guests in the institution, and therefore they must conform to all of the policies and procedures that RNs have to follow as well, including HIPAA and things like that. So usually the extern orientation is about 2 to 3 days, again, depending on the institution, where the extern is exposed and trained on the documentation process, policies and procedures, computer orientation, and we do spend some time in the orientation just allowing the externs to get to know one another. Many times, depending on the size of the extern cohort, there could be 20 different nursing schools represented. So it's nice to have the externs share their undergraduate experiences with one another and get to know one another as a cohort in the extern program. So some of the other benefits of extern programs are that it encourages critical thinking to foster clinical reasoning while using a holistic perspective regarding patient care. So as we move beyond COVID-19, and I'm sure many of you realize the very quick shift from clinical into simulation due to COVID, extern programs really picked up the clinical education piece and allowed students to really have an immersive experience in the hospital environment when their clinical was canceled due to COVID. So as we move beyond some of the constraints on academic clinical education and move beyond COVID, it is really time for us to align our thinking with nurse leaders from the American Nurses Association, who stated that nurse leaders in our profession must harness these times of change to challenge assumptions of how we educate nurses. The ANA recognizes embracing innovative pedagogical strategies to broaden clinical education. The Institute of Medicine report, Future of Nursing, Leading Change, Advancing Health, and most recently, the National Academy of Medicine report entitled The Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity, as well as other leaders in our nursing field, such as Benner, Sutphin, Leonard, and Day, really recommend that we use transition to practice residency programs for new graduates and recommend reforming undergraduate nursing to allow for more clinical immersion experiences. So these extern programs, very similar to transition to practice residency programs, allow for the alignment of clinical immersion experiences to reinforce safe patient care, clinical reasoning, and use holistic decision-making approaches. When students are immersed in the clinical environment through nursing externships, real-life opportunities are presented that benefit students' knowledge. And as we all know, this is essential for the new novice nurse's survival in today's complex healthcare arena. This is sad, but according to the Bureau of Labor Statistics in the United States, in 2018, the RN workforce is expected to grow from 2.96 million to 3.4 million in 2026, which is a 15% increase. This is due to the aging nursing workforce, but it's also due to the fact that many new nurses, and this just makes my heart break as a nurse educator, many new nurses only stay in their field of practice for about a year after they graduate. So something has to change with the way they experience clinical. Reasons noted in the literature for these new nurses leaving practice after only a short period of time is the fact that they are still experiencing reality shock. They don't feel prepared for practice, and they feel unprepared to meet the challenges of patient care. To offset this, externships can really help to fill the gap and ease that transition to practice. Another way that externships can really benefit the nursing extern is to really align themselves with RN role models. Nursing externships foster these relationships, and many times these externs maintain their relationship with their RN preceptors long after the externship ends. They are helpful once they return to school, and these preceptors are also helpful once they begin practice as a new graduate nurse. So that's a really rewarding thing for me to see as an extern faculty coordinator, is the neat relationship that these externs develop with their RN role models or preceptors. The success of these programs is largely dependent on the nurse clinical preceptors who are with these externs day in and day out, really foster their growth and development and critical thinking. So to get back to one of the polling questions, some of the things that externs are allowed to do, what is in their scope of practice, is that they may assess, they may document, they may give report, they may do skills that the preceptor and the nursing faculty feel comfortable with them doing. So they can really do a lot of skills, but they may not usually administer medications, especially IV push medications. They may not administer blood products. They may not start IVs or work with IV infusion pumps. They may not draw blood, perform heel sticks, and that's particularly in pediatric environments or in NICU environments, depending on where the extern is working. They may not consent for different procedures, and they may not waste narcotics. And recently with COVID, some of the policies and procedures have changed regarding the ability of the extern to administer breathing treatments or even be in COVID positive patient rooms. So one of the things that needs to kind of change and be a little bit tightened up with extern programs across the nation is really kind of standardizing what are externs allowed to do versus what they're not allowed to do. But generally, what I just shared with you is what they are not allowed to do. Oh, I think I went ahead twice. Okay. So the other role of preceptors is to allow for externs to be enculturated into the culture of nursing, to see what the environment is on a day-to-day clinical immersion basis. So they see these nurses working day to day. They feel like they're more of part of the team and not just being a student nurse on a clinical unit that's there one day and then not. So there's much more enculturation of the nurse extern. And hopefully when they feel like they're more part of a team, they will want to work on that team after graduation. So that's really a nice thing also. It's encouraged for the preceptors to have student externs share in the report process, the rounding process. They're to take the students with them for breaks and lunch and things like that as well. So introduce the externs to the culture of nursing to increase the likelihood that they will choose an acute care facility as their specialty upon graduation. So usually the students, as I said in the beginning, they will pick 2 different units in which they want to participate. So hopefully the nurse extern will like one of those units and want to work there after graduation. Or they might decide, this acute care is really not what I thought it was going to be, and I don't want to work there after graduation. I always tell the externs that this is not a bad thing either, because imagine if they would sign on to work in the ICU after graduation, and then they spend a whole year there realizing that's not what they want, rather than a short summer doing it. So I think that's a good thing as well. They can really try out different units, see what those specialty areas are like, and identify if that's an area that they would like to work upon graduation. Okay. So as far as benefits to students, as I mentioned, there's quite a few. Gaining clinical experience and just being immersed in the setting is very, very helpful. So it's an 8 to 10 or 12-week clinical immersion process. Other benefits for the student is that they increase their assessment skills, they are better at documenting. They also report in the literature that they're able to think on their feet a little better than not having this externship experience. Last summer, I actually completed a study on nursing externs working during a pandemic. And one of the other real benefits to those students working during a pandemic is that they saw the resilience that is needed for these nurses. They witnessed firsthand teamwork at its finest. They witnessed and learned about the need to be self-advocates rather than advocating for their patients, and with advocating for their patients. I felt like, though, as a nursing educator, I educated so much about the need for our students to be advocates for our patients. A big role of the nurse is being an advocate for our patients. But I didn't really emphasize the need for nurses to be self-advocates, to speak up for themselves, to speak up for their teammates. So that really kind of hit me last summer as well. So some benefits for nursing faculty: reinforce current clinical concepts, network with some of these preceptors to identify some potential adjuncts that we can use in nursing education. And we all know that there is a nursing educator shortage as well. So me working as an extern coordinator, I was really able to identify some preceptors that did an outstanding job and kind of recruit them to come on board as nursing adjuncts. So that was a real big benefit. Also, academic faculty can gain hours clinically to maintain specialty certifications. And it's a great way to augment clinical and classroom teaching, where you are able to share some of the very relevant clinical stories that you've learned over the summer. So there's lots of benefits for academic faculty as well. What are some of the roles of academic faculty? I want to kind of highlight that also. Academic faculty, like myself, were responsible for kind of orienting the extern, rounding on a day-to-day basis with the extern, kind of asking them clinically related questions like we do when we are in clinical with our students, but you don't do the evaluation process with them. You don't really fail anyone in clinical during an extern program, but you can see what their progression is like, foster that clinical growth and improvement, communicate with preceptors to identify what are some of their learning needs. So there's lots of ways that academic faculty can help with externships. As far as benefits for the healthcare institutions, work with students as potential hires. And in the literature, it is noted how Participation in extern programs do impact the recruitment, do impact the onboarding of new graduate nurses, and also positively affects retention. One study noted that the cost of orientation of a new graduate nurse is decreased by about 47% when that graduate nurse participated in an extern program. Another study noted that there was a 95.2 retention rate over 5 years for nursing externs. So nursing externs in orientation are told to really put their best foot forward and try to learn everything that they can, because it is thought to be their foot in the door upon graduation if they're interested in working at that institution. So from some of my previous experiences, and I ran an extern program for 22 years, one of the lessons that I've learned in looking at student evaluations and feedback is that I developed a unit ambassador program point person. And this person, along with the nurse manager and the staff on that unit, welcomed the extern to the institution and to the unit. It was more of this ambassador was more of a welcoming person to the unit and to the culture of nursing, and served as a resource for some general hospital related questions. Other benefits to participating in extern programs was we developed, and this was based on previous student evaluations, extern evaluations, we developed a lunch and learn. And these lunch and learns took place every Tuesday, and we just picked a certain time and regularly scheduled day, Tuesday at 11 to 12. We would all have lunch together. And during these lunch and learns, it was kind of an informal thing where the externs shared their experiences. What is it like on their unit? What did they learn? What are some cool things that they saw? They shared with other externs while they were eating lunch. So it was an optional thing. If they could come to lunch and learn, it was highly encouraged, but it was not mandatory. If there was something going on in their unit, then they could decide if they wanted to stay on their unit or come to a lunch and learn. But it really developed because the externs reported in their evaluations that, in the beginning in orientation, they saw each other a lot, and then they all went to their own units and nobody saw each other anymore. So we developed these lunch and learns every Tuesday at 11 so that the students could reconnect with one another and share some of their experiences. Another benefit to the student was that I developed and provided post-clinical conferences. So these were held every Wednesday from 2 to 3:30. These were more of a mandatory type of conference. They were on various topics, such as EKG interpretation, care of a trauma patient, roles and responsibilities of a chaplain, what is a social worker, what is a case manager. I developed, one of the post-conferences was a panel where I had a caseworker and a chaplain and a various other hospital people on the team who shared their roles, so that the nurse externs gained an appreciation for some of the other members on their healthcare team. Again, I feel like in nursing education, we are so focused on imparting what is the role of the nurse that I know I sometimes forgot to emphasize, this is a social worker. What is her role? This is respiratory. What is their role? How do we work with, in an interprofessional, collaborative manner, with these other members on our team? So this past summer, we had an exercise post-conference where we focused on the importance of exercise as a way to build resilience. We did one on sleep. We did one on nutrition. Other topics clinically were interpreting lab values, but lots and lots of topics in these clinical post-conferences. The other benefit to students is observational experiences. So one of my roles was also to kind of coordinate different observation experiences for the externs, where, let's just say, if they were on a cardiac step-down unit and they wanted to go and observe open heart surgery, I would facilitate that observation. Other externs were interested in wound care, so I developed a wound care observation experiences where the extern could go and circulate for the day with a wound care specialist. Other examples are they went and saw neurosurgery if they were working in like a trauma unit. They went with a diabetic educator for the day. Other students observed in gastroenterology labs. So it was just a matter of whatever the students wanted to do that kind of related to their clinical unit. So they were allowed to each do one observation day in one of the 2 different 4-week rotations. Our externship program was a 8-week program. So they had 2 4-week units where they were observing. So they were allowed to do one observation the first 4 weeks and one observation experience the second 4 weeks. So those are some other benefits and some of the things that I facilitated as an academic faculty member. So just some ways to build collaborative partnerships and strategies to build a successful extern program is really to identify the needs of all parties and kind of begin with open communication between the clinical agency, the staff development, human resources, and academic faculty, and kind of identify the needs of all parties. Open communication is always very, very important. So plan ahead to really engage and orient the preceptors. Identify if there's a unit perhaps that has a lot of new hires. Maybe they can't take externs that summer. They're overwhelmed with clinical orientation of their new hires. So just working with the institution to find out what works for them. But communication is the main important thing. Ask the externs. So again, identify needs of all parties includes the externs. Ask them in the beginning, what do they hope to get out of this extern program? And identifying how we can help make, the most out of it for them, within reason, of course. What are the finances of the institution? How many externs can the institution care for? When I started the extern program in 2000, we took 12 externs. That was it. We wanted to kind of trial it, see how it would work financially. We built that up to 84 externs on 2 different shifts, days and evenings. And they worked Monday through Friday. So we kind of changed it since then, but that's how it was in the beginning. So identify the needs. What are the finances? What are the number of preceptors that you will have available on the units? So just kind of always evaluating to see how you can improve and change the externship based on the needs of the facility and the institution. So more research definitely needs to be done in the area of extern programs and kind of identifying standardization of extern programs. What is the benefit? Do they pass NCLEX more often on the first time try than those student nurse graduates who don't participate in extern programs? So what is the recruitment? What is the retention rate, first time pass rate? All of that is really important to kind of focus on as well. At the end of the extern program, I always had a closing ceremony, kind of a graduation, gave them a certificate of completion that documented how many clinical hours they completed. So ours was 40 hours per week, and it was 8 weeks. So we had the total number of clinical hours. And then again, re-emphasize the foot in the door as an extern at that particular extern site. So we had the chief nursing officer come and talk with the externs at the end of the program to kind of welcome them and introduce the fact that they can apply as internal graduates. So it was a real nice kind of closing ceremony where they really felt like they spent their summer in a worthwhile manner and really completed and learned a lot about the program. So I'm happy to answer any questions that you all have. I have lots and lots of references. I'm happy to share many of those with you. I'll point out this reference. My colleague from Georgetown and another colleague from PA College of Nursing and myself, we completed a study a couple of years ago. We actually did the study in 2018 and had it published in 2019, where we looked at, there were 240 externs, and looked at their confidence level before and after the externship, looked at their anxiety level with clinical decision making before and after participating in the externship, and really noted some very positive, very worthwhile findings regarding their ability to feel less anxious and be able to make clinical decisions with less anxiety. And then most recently, I published with 2 externs ways in which nursing externships foster that interprofessional collaboration, build resilience, and self-advocacy. And that's coming out in Nursing in the fall. That article will be published. And I already mentioned this one regarding the experiences gained during a pandemic. So lots of good stuff is coming out regarding some research and work on externs. So I'll be happy to entertain any questions that you might have.
Thank you so much for sharing all of this great information. We'll open it up for questions. So if you have any questions, please use the questions feature on the GoToWebinar control panel. While we're waiting for some questions to come in, I do have a question in regards to the retention rate that you spoke about and the decreased cost for the onboarding of these nurse externs. Yeah. How would you recommend starting the conversation with leadership if this model is not currently being used but seems to be a way that might foster some great relationships with local colleges and to get those nurses in the door?
Yeah, one of the ways, Linda, I'm trying to do it is through publishing the benefits of extern programs. In this area where I'm located, I was very fortunate to be able to help start several different extern programs. And based on the need of nurses right now, the shortages of nurses, that's been very fruitful as far as hospitals and healthcare organizations being very interested in starting it. So that's one way, just networking, sharing the literature and positive research. I'm also partnering with our operating room locally to develop an extern program that's kind of focused on perioperative nursing, because there's a great need in that area for new graduates to apply. So just sharing the knowledge and helping develop programs is one of the ways that I would tell everyone to really put that word out there to begin extern programs. I think a lot of educators, at least in this area, felt that, and this is years ago, felt that nursing extern programs were beneficial for those student nurses who struggled in school or had a little more trouble navigating clinical and that kind of thing. And I think now the focus is really changing to see that externships help all students, not just those who struggle in the classroom or in the clinical setting.
Thank you for that answer. We have a couple more questions that came in through the chat.
Sure.
Are the externs paid the same rate as the nursing assistants or at a higher rate of pay? Do you allow nursing students who already work as nursing assistants in the hospital to be in the externship program at that same hospital? So kind of a multifold question there.
Okay, so let me say nurse externs are paid slightly above what a nurse's aide would be paid. I don't have the exact figures, but I want to say it's like $1 to $1.50 more than what a nurse's aide would be paid. Now, again, I'm in Pennsylvania, so that may vary depending on what state you're in. So yes, they are paid slightly above a nurse's aide. And the answer to your second question is also yes. We do allow nurses' aides, and I've had several of these, also work as an extern during that summertime. Here's where it gets a little tricky. They can't work more than 40 hours a week because then they would have to be paid as overtime. So what we did was we only had those externs work 4 days a week. And that 5th day, they would work as a nurse's aide. Oftentimes, they would pick a weekend to work as the nurse's aide so that the money would be comparable because they would then get a shift differential for the weekend. Yeah, so you kind of have to think about the hours total that the individual is working, and you can't have them working overtime.
I think that's a really good point to clarify there because it could get pretty hairy, I think, pretty quickly.
Yeah. And I'll be honest, that is not something I thought of. That is something that the HR people were really right on right away. And so again, having that open communication and working together as a team in pulling these externships off, it's a concerted effort between everyone.
So we have a question regarding collaboration. Can you tell us a little more about the collaborative aspect of the externships? I'm not sure how the faculty fit in since the externs were employees.
Okay, so how I fit in, I was a faculty at a local university, and I also worked at a local healthcare facility. So I really developed this externship program working with human resources, working with other academic faculty to say, when is this externship going to start? When are we done with our school academically so that they could have like a week off and then start the extern program? We wanted to give them some time off in August before they went back to school. So what's our start date? What's our end date? So really collaborating on all aspects of the externship. I then worked to coordinate having a faculty member with the externs every day. So I developed a schedule where there would be an academic faculty member rounding with the externs every day, talking to the preceptors, meeting with unit management to identify that everything's going well. Again, I said organizing the observational experiences. So there's lots of different collaborative opportunities, working with other members of the healthcare team to have them come in and speak in post-conference. I hope I'm answering your question. There's all aspects of collaboration. And I was paid by the healthcare institution to do this. I was not paid from the university where I taught. I was paid by the healthcare institution, as well as the other faculty that I hired. They were paid by the healthcare institution. Does that help? Hopefully.
Yeah, we'll see if yes, she said it helped with lots of exclamation points.
Okay. And I'm happy to answer any questions if you want to email me. I think Linda and Megan are going to share my email. I'm happy to answer any questions, later if you think of any that don't come up in the next few minutes.
Perfect. Yeah, and we will definitely share Dr. Ruth Saad's email in the chat feature for you. So please feel free to reach out if we don't get to your questions. The next question we have is, has there been externships, quote unquote, in between the years of nursing school, i.e. summer employment to learn skills like starting IVs, doing dressing changes, etc.?
Well, dressing changes we did cover. So they would round with a wound care, and they learned that kind of thing with the wound care nurse. And I'll share another interesting thing that we did, and I didn't mention this. One summer on their evaluations, they noted that, as a sophomore, they learned all of these skills: Foley catheter insertion, dressing changes, sterile technique, enemas. They forgot that by the time they become an extern or by the time they graduate. So one summer, we just had a skill session where we had different skills, just like you did in like your simulation lab teaching students. We had different skill stations set up in one of our post conferences. And the student externs could go around to the different skills. We had 3 academic faculty there that day, and they helped to reinforce the safe skill practice, really focusing on quality of patient care, not how fast you complete the skill, but are you completing it correctly in a safe manner. So that was another factor that we did, and the students really liked that a lot. I think I got off task. Did I answer your question?
I think you did. I think so.
Okay. Linda, say the question again so I can make sure I answered it.
Yeah, has there been externships, quote unquote, in between the years of nursing school?
Oh, okay. So in between the years of nursing school, I mentioned in the beginning there's like an extern 1 and an extern 2. The extern 1 was between sophomore and junior year. The extern 2 was between junior and senior year. So that's really kind of the in-between nursing school. Our academic institution just started a January term, and we are kind of throwing around an idea of doing a 3-week perioperative extern program. So that's kind of being discussed right now. And I know I spoke with someone in Canada as well who was interested in starting kind of a perioperative extern program. I'm not sure when they would offer it.
Oh, that's very interesting.
Yeah.
Speaking back to the recruitment rates and the percentages, one participant wants to know those rates again. So the recruitment rate and percentage for the nurse extern programs with the new graduate within the same organization.
Okay. So one study noted that, let me see if I can find that so I don't misquote anyone. And I'll be happy if she wants to email me, I can send her the reference where I saw that these statistics. Some studies validate the cost of orientation is decreased by 47%, and that there is also a decreased turnover and increased retention. The 95.2 retention rate was noted to be over 5 years. So that's a real positive number for sure. And I'll be happy to share that reference if she wants to email me.
That's perfect. Yeah. And then it looks like we have time for maybe 1 or 2 more questions. And this question goes along with the cultural environment of the organization. So something that we can't quite control as much. During the lunch and learns, was there a fear from the externs of any repercussions if they spoke of negative situations or if they had cultural concerns on their units that they were working on.
Yeah, thank you for that question because you're absolutely right. One of the things that we really tried to be proactive about was setting the extern program up in a very positive manner, both when we oriented the preceptors, when we engaged the unit ambassadors, and those were the people, along with the managers, who really wanted to set this positive, welcoming tone to the extern to make them feel wanted and part of the team, etc. So we told the externs from the very beginning, if you have any trouble at all, please let us know. That's part of our role as faculty. When we round, we'll try to meet and discuss and take care of any negative issues. But I think really these preceptors were very energized and enthused and excited to share what they do on a daily basis with these externs. They also realize that they're shooting themselves in the foot. If they don't welcome these externs and really foster their learning and growth, they're not going to want to work there when they graduate. So we need nurses, and externs were put in units where the nurses were needed. So, we tried to be very proactive with that and set things up in a positive manner from the start. And I have to Any other questions?
I think we have one more question that we could address in regards to credit hours. Is the extern charged by the college university credit hour to be enrolled into the program?
So you're asking if the extern gets credits, college credits for participating in the extern program. Am I understanding the question correctly? If that is the question, the answer is no. Students do not get college credits for working as an extern program.
Yeah, I think that's the angle that they were going for. Is this something that the student has to pay additional for as a college credit hour program?
No. So it's not aligned with the college at all. This is something that the student does in addition to their education as a way to augment their clinical experience. So the extern is paid by the institution, but no college credits are accrued for it.
This has really been a wonderful discussion, and I'm so thankful for the active involvement of all the participants. Unfortunately, we're at time right now, so we did provide Doctor's email in the chat feature. So once again, if you did not have your questions answered, please feel free to reach out to Dr. Roussad via email, and I'm sure she would love to answer your questions.
Thank you so much.
We want to thank you for sharing all of this great information. Sigma is thankful that you took the time today to share with our audience. We definitely look forward to hearing more from you in the future.
Thank you.
You're welcome. We hope that you enjoyed this webinar. As a reminder, 1 week from today, we will email you a link to the evaluation for you to obtain your Nursing Continuing Professional Development Certificate. Be sure to check out Sigma's upcoming webinars and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars are freely available on the Sigma repository. Thank you everyone for joining us today and have a wonderful day.
Thank you.